guys, Nick Mahavich here, Active Spine Physical Therapy. As therapists, when people come into our clinic, what we do is we have to try to figure out where their pain is coming from. What I wanted to do for you today is try to give you some tests that you can do at home to kind of self-diagnose and give you a good idea of where your pain is coming from. So when people deal with neck and shoulder pain, it's an area that can get a little confusing where that pain is coming from. So I'm going to give you a couple tests you try at home, and that lets you know, is it my neck or is my shoulder? It should give you a really good idea of where that pain is coming from. So if you're having some pain and you feel it up in the neck, maybe on the top of the shoulder, most likely coming from your neck. Now, to confirm that, what you would do is, if you have pain with any kind of head movements, most likely neck pain. A real good test to really clarify that is if you have pain, say on your right side, what you're going to do is look up to the ceiling and then kind of lean towards that side. Now, if you lean towards that painful side and it reproduces your pain or causes an increase in pain, most likely your pain is coming from your neck. Now, if you have this pain that's up here, maybe down into the shoulder, and we don't know, is that referred from the neck or is it actually the shoulder that is hurting? Well, here's a little test you can do to confirm. What you're going to do is hold your arm out to the side, and then, like if you had a pop can in your hand, what you're going to do is empty that pop can out. It's called the empty can test. And if you have pain that comes on when you do that, or when you empty it out and you kind of come across your body and that produces pain in the shoulder, most likely coming from your shoulder. So a couple easy tests you can do at home to let you know where your pain is coming from, and then you'll know what's going on. And then if you go see the doctor or your physical therapist, you can kind of give them a helpful hint on, this is what's happening and this is what I think my pain is coming from. A good therapist should listen to you and say, yes, that sounds correct. Check out our next video. We'll go over some things that you can do to help remedy those things. We'll talk to you soon.